Hi everyone, today let's look at if this video is fake. I got sent this on a WhatsApp group that I'm in with a whole bunch of surgeons who perform dental implant treatment all around the world. Let me just show you this video and then we're going to walk through it step by step and I'm going to give you my opinion on what's actually going on here. So let's press play.
Yeah, I did go to Turkey to have it done, but I wanted to look pretty and now I don't. I decided enough's enough, I need to go and get my teeth done. So I've come out to Turkey, to Antalya. I did my research. Seems to be a good company to go to. Really scared today. So I'm having implants done. I'm having the all-on-6 treatment, top and bottom. They're pulling all my teeth out and then stitching them all up.
It only took a few weeks for things to start going wrong.
And look what happens. They fell out. Right.
She needs to contact the surgeons as soon as possible.
And now I've got to glue them back in. Who knows?
Unfortunately, this was only the beginning of her problems. Soon, the entire structure of her face began to dissolve before her eyes.
I'm on antibiotics now, cocodamol, naproxen. Problems I'm getting now is the jaw ache is so bad. Because this is bacterial infection. No antibiotics are working to take it away. But I've got to control this somehow until we can take the implants out.
Her original surgeons refused to help her, so she was forced to seek help in the UK.
When I take out my dentures, the pain is excruciating. These implants are, and my whole face, I just want to pull it off. I don't know what my next steps are. I don't know what they're trying to do. Are they just waiting for me to die? I can't walk around with this anymore. My face didn't look like this last year. I swear every day it's getting worse. Oh, the pain is horrible. I just want this pain to go away. Everyone keeps saying to me, just go and get them taken out. Can't just go and get them taken out. I've got 14 implants in my face. They've got to be surgically removed from my face. I don't have tens of thousands of pounds to go and get it corrected somewhere. They won't admit me into hospital because there's nothing they can do.
Right, okay, so let's start at the beginning and let's...
Yeah, I did go to Turkey to have it done, but I wanted to look pretty.
Okay, the immediate thing that you're going to find with any of these viral clips is the first few seconds are the attention grabbers, okay? And you see this picture with this lady with all this stuff going on her nose, and it's not necessarily dental related, okay? It may well have been caused by the dental treatment. It's really, really unlikely that dental implants in themselves would have caused this, okay? But let's walk through it.
Decided enough's enough, I need to go and get my teeth done. So I've come out to Turkey, to Antalya.
Okay, so she's telling the same story which we've heard a million times before. Everything's too expensive in the UK, so I'm going to go abroad. I've done a whole load of research. Research is literally just reading stuff on the internet, okay? And come on guys, we know the internet is not 100% truthful all the time.
My research seems to be a good company to go to. Really scared today. So I'm having implants done. I'm having the all-on-6 treatment.
Okay, so she's saying that she's having the all-on-6 treatment, top and bottom, okay? So as I've said in like a million videos, the number doesn't matter, all on X, it's an immediate loaded, you're just having dental implants, okay? Whether you have 6 or 8 or 10 or 4 or whatever, the number isn't that important, okay? It's more appropriate that you see a clinician who builds a plan specifically for you, but okay, whatever, she's having all on 6. And what really annoys me is this, it cost £45,000 less to get this in Turkey, right? Now, that is absolute BS. There are so many providers providing low-cost treatment for this procedure in the UK. I mean, we are pretty much more of a premium location, and I've never charged £45,000 to have it done here, okay? And what they're saying is £45,000 less. So typically from the patients who we see and ask them, okay, how much did it cost? It's somewhere between £8,000 and £12,000 to get full mouth done in Turkey. That means this lady has been quoted £50,000 to £60,000 to have this done in the UK. Again, it's just one of those titles to spark up emotions and make somebody, you know, continue reading on.
Top and bottom, they're pulling all my teeth out.
Okay, she didn't have 6 top and bottom. She's had 7 at the top and 6 at the bottom. It looks like this this X-ray doesn't go all the way across. But from the X-ray, what we can see is that, I mean, this is a really weird positioning of the implants. The upper implants, yeah, fine. There's one implant on the top left, which is, it looks like it's kind of poking into the sinus, which isn't really best practice. They've utilized some of the bone at the front, but they haven't really utilized it efficiently. If I was going to do this treatment, then I would go for a standard kind of all-on-4 approach, because I can see that she's got a good amount of bone and she's in the kind of the 70% category where we don't need to do anything special. We can just go with a tried and tested angled implants at the back, straight implants at the front, and that's enough to support a great smile. Now, what we can also see is that they've only loaded, okay, the front 4 implants, and loading means putting temporary teeth on the front 4 implants. And I can tell this because of the style of abutments that we have on those 4 implants, okay? Now, the 2 implants at the back on the right, these implants have got nothing on them, so they've been fully covered over. And we would do that if the implants aren't particularly tight, and you get this issue if you're putting implants at the back, at the top, the bone quality is not great. Okay, and then the implant on the top left has got a different type of abutment, so that's got what we call a healing abutment. Basically, the surgeons are thinking of using these implants at a later date, but they've not been used in the initial phases. And it's a similar kind of story at the bottom. These 4 implants at the front have been used. I say front, I'm using that term really, loosely, because everything's really at the side. There are no implants at the front. And the jawbone at the bottom at the front is typically the best jaw quality bone, and they've deliberately decided not to do this. We have a nerve that comes down on both sides, and it looks like those implants are literally placed around where that nerve comes out. It's like the danger zone that you really want to stay away from. Anyway, this lady's not complained in this video about lip numbness, which is what you get if that nerve gets damaged. But we can see, again, we've got these temporary, we've got these abutments on the front 4 implants, which are supporting her temporary teeth. So on the day of surgery, you have temporary teeth. I can tell, and we'll see this in the later video, that later on in this video, that these abutments are only supporting a cement retained temporary prosthetics. I'll explain why that's important.
And then stitching them all up.
It only took a few weeks for things to start going wrong.
And look what happens.
Okay, so her lower prosthetics have come off, okay? Look, honestly, this is not a big problem, okay? They've come off, but they shouldn't. If you're having an all-on-4, which is done in the kind of traditional way of doing it, what would happen is the implants would go in, and then the bridge, the bit that you see, the teeth, these are screwed in position, okay? Not glued in position. Now, the difference, does it really make a difference? In my opinion, yes, it does, okay, for a number of reasons. First of all, if you have something which is screwed in and out, at the time of making it, we can take it off, we can clean what's called the fit surface of this bridge, and we can make it really smooth so it doesn't harbor any bacteria. That improves the success of our treatment. If we have something which is glued in position, first of all, it's super cheap to make, because all you do is make a hollowed out set of teeth, you fill it up with glue, and then you put it in position. There is little to no adjustment done after that. Okay, so we've got this potential where there could be excess glue, it's going to create a rough surface, it can't be finished again. But it's come off, okay? Now, another advantage of having something screw retained is if we're putting implants in and we're putting teeth on top, the whole reason that all-on-4 traditionally works so well is that these implants are splinted together. That means there's no one implant which is getting more force. In the early days, whilst things are healing, everything is susceptible to, I mean, implants hate movement, okay, movement forces. So if you were to eat something really hard and constantly crunch on one side, that's going to put loads of force on one side. If you've got a single implant taking all that force, we're going to lose it. If you've got 4 implants all splintered together with a rigid structure, then we're much more likely to keep the implants. And that's the secret sauce of why this implant treatment works really well. Right now, all she's complaining of is that the bridge has come off. Okay, it's an early complication. It happens. It's not surprising. It's not going to threaten the health of our implants. And realize now that she's complaining about her lower teeth now, but the main issue is going to come with the top.
They fell out. Right.
She needs to contact the surgeons as soon as possible.
And now I've got to.
Okay, the voiceover, again, it's like over dramatizing this. It's turning this little problem into a big problem. Yes, you know, you should definitely contact, but this isn't the main issue.
Glue them back in? Who knows?
Unfortunately, this was only the beginning of her problems. Soon,
okay, now we can see stuff happening with her nose. Okay, and this, I don't know what is happening. This looks really... It looks horrible, and this is going to ruin this lady's life. Okay, I don't know if this is AI and it's been made to look worse, but there are so many different camera angles, and it looks like it's getting worse and worse as time goes by.
the entire structure of her face began to dissolve before her eyes.
I'm on antibiotics.
So she's on antibiotics, which suggests an infection. Okay, if the implants have caused an infection, number one thing is to get rid of those implants. Now, in our experience, we've had implants which have become infected and we've had to remove those. Never is it more than a local problem. And local, what I mean is a problem which is kind of isolated around that implant. This is starting, okay, when you got the nose involved, the nose is connected to the sinus, and that would suggest maybe something, you know, communication like that. But it's very rare. There's hundreds of implants which have been placed, hundreds of thousands, I should say, which have been placed and accidentally they're in the sinus. It's never a problem. An implant in the sinus very rarely causes a problem. This is more like an issue with maybe the front implants which have interrupted a blood supply or something like that. This looks very different. Other symptoms that you might get, so this is no longer a local problem, okay? If you've got a bacterial infection and it's affecting your whole body, then you're going to have a raised temperature, you're not going to feel great for a long period of time, you know. There's a lot of what are called systemic signs of infection.
The cocodamol, the proxim problems I'm getting now is the jaw ache is so bad.
Okay, the jaw ache, I mean, it's going to be related to an infection, okay? But again, when we've got these situations where we've got these glue cement retained bridges, you can never really get the bite, you can't dial the bite in. With the temporaries, if they're screw retained, I should say, if they're done in a normal way, you can adjust the bite and you can get to a better bite. Now, having the bite not correct for 90% of people will not affect them in any way. They were not going to get jaw symptoms. However, there are some people who are much more susceptible to changes in the bite, okay? And the bite is a complicated concept in itself, so we're not going to go into that in a lot of detail. But she's complaining of jaw pain. It's likely to be caused by something other than the bite, just looking at this video, but the bite can cause jaw pain as well.
Because this is bacterial infection, no antibiotic.
Okay, she's saying because this is a bacterial infection, no antibiotics are going to help. That's the absolute opposite. Antibiotics will target a bacterial infection. Okay, there are different types of antibiotics which will target different types of bacteria. That's something else. But you know, if it was viral, like a cold, having antibiotics for a cold is ridiculous because it's not a bacterial infection. Anyway, as a patient, obviously, you know, it's easy to make a mistake like this. I'm kind of being pedantic.
It's working to take it away, but I've got to control this somehow until we can take the implants out.
Her original surgeons refused to help her, so she was forced.
Okay, again, this voiceover AI thing is kind of really over dramatizing this thing. When it says the original surgeons refused to help her, from all the patients who we've seen, even people who go abroad, if they have a problem, it's not like the door is completely closed. Yes, they will make it difficult, but it's very rarely a complete, hey, look, we're definitely not going to see you.
How? Until we can take the implants out.
Her original surgeons refused to help her, so she was forced to seek help in the UK.
When I take out my...
She was forced to seek help in the UK, like it's a bad thing to have to seek help in your own country.
dentures, the pain is excruciating. These implants are... And my whole face, I just want to pull it off.
I mean, her nose is looking really bad at this stage. I mean, I don't think it's a fake video. It just doesn't have that feel about it. The captions going over the top, absolutely AI and fake. But I don't know what's causing all the issues with the nose. There is something else going on. And on the kind of the WhatsApp group with the surgeons, there was people commenting, and I think the general consensus is that this is not just an implant complication.
I don't know what my next steps are. I don't know what they're trying to do. Are they just waiting for me to... I can't walk around with this anymore. My face didn't look like this.
This is the most heartbreaking thing for me, because a big reason for her seeking help in the first place was a cosmetic improvement, okay? And just improving her smile would give her extra confidence, but it's been absolutely disastrous. Like, if someone's left like this, the problem is now lifelong. And it's very difficult. I imagine it's very difficult. The nose is not my speciality, right? This is very difficult to fix.
Last year, I swear every day it's getting worse. Oh, the pain is horrible. I just want this pain to go away. Everyone keeps saying...
It says at the bottom she can't afford to get it fixed. Like, I get that, okay? You're not going to get this fixed under the NHS. You've already spent a load of money having this done abroad. Often the payment is up front, and now you're in the situation where you've got this problem. And first of all, very few UK dentists are going to want to, or be able to help, okay? Removing implants, although if you're experienced, it's not that difficult, but most people don't want to get involved with stuff that's been done abroad.
Me, just go and get them taken out. Can't just go and get them taken out. I've got 14 implants in my face. It
didn't look like 14 implants on the x-ray, but anyway.
To be surgically removed from my face.
Yes, they've got to be surgically removed, but the implants aren't really in your face, are they? Like, I don't know. Sometimes all of that stuff, it frustrates me when we're using words to be more emotive, to almost try and gain sympathy. I agree that this is a terrible situation, but the truth is, yes, you can have implants removed.
It means my whole face is going to collapse. No. I don't have tens of thousands.
Okay, your whole face is not going to collapse if you have implants removed. And often, if an implant is infected, it's actually very loose and very easy to remove. If an implant is fully integrated and there's no problems, that's when an implant removal becomes much more difficult. I don't have tens of thousands of pounds to go and put this right. Having the implant removed, dealing with an acute problem is often not the expensive bit. The expensive bit is the rebuild project, okay? But you've always got the option to have implants removed and go into dentures. You can get dentures on the NHS as well.
Pounds to go and get it corrected somewhere. They won't admit me into hospital because there's nothing they can do. I've done it myself. I've literally gone up there, sat myself in front of the ENT corridor ward and said I am not moving until someone sees me. They just said no, there's nothing more we can do, sinus rinse. I know I look ugly. I know I look horrendous.
Again, we don't know the full story here. She's sought ENT opinion. Excellent, all right? If the ENT is agreeing that this is a sinus problem, a rinse will help clear that infection, okay? But obviously she needs to remove the source of the infection if the source of the infection is the implants. Remember, we don't know this. We're going off a video. This isn't a detailed diagnosis. This is just my opinion because I know a little bit about this subject, but this whole complication, we don't know the details of it.
Do this to raise awareness. This is horrible. Wouldn't wish this on anybody at all. look at me as like a walking disaster to just don't get us in. Just keep to your teeth as they are.
She urges people to avoid this surgery to prevent others from enduring what she has.
I just want to be out of this pain. I don't deserve this, I don't.
Nobody deserves that, okay? Having a pain in your mouth is horrible, okay? It's absolutely horrible. And having a chronic pain over many, many months, it looks like, and it's disfiguring. We've had patients on the brink of suicide because of this pain, okay? And sometimes it's really difficult to diagnose this pain. Nobody deserves this, okay? She's had a problem, she's had a complication. The complication just needs to be addressed and fixed. Now she's in a state where she's just left alone, okay? The people treating her are a million miles away, not a million, but you know what I mean. Very difficult to get hold of, and it doesn't sound like they're willing to help. I really feel sorry for this lady. Like, if this is true, this is a terrible situation.
Yeah, I did go to Turkey to have it done. Well, I wanted to look pretty, and now I don't, and I look like Shrek, and it's horrible, and I don't know when it's going to end. But please never go and have anything done. Stay the way you are. You are pretty the way you are, just don't have anything done.
Look, if this was the outcome for every single patient, absolutely don't have it done. This isn't a good outcome. This is being in a much worse situation than where you actually started out. I genuinely feel bad for her. Okay, this is it's a terrible situation to be in. Every treatment that you can imagine, any medical intervention, not just dental, any medical, everything has potential side effects, potential risks, and these risks are typically managed, and they're typically small. The disaster stories are if they're not managed properly. The safety net that you have in doing a complex treatment in your country is that you've got not only just a legal leg to stand on, but there are pathways, especially in the UK. If there is a complication and your surgeon is not experienced enough, there are more experienced surgeons around, and it's done in the UK, and there is a bit of a network to take it, one step further. But then also there are hospital pathways that you may need to explore, and people are just more open to helping because it was done here on home ground. There's a lot of regulation in the UK, right? From all the dental services are regulated to a high standard. It really does push up cost, but that's the safety net that you have. But we also have to be aware that this is a really rare occurrence. And we need to take this story with a pinch of salt as well. Okay, it's easy to see something on social media and be influenced by a certain message and a certain way of marketing things. As an insider, as a person who's always providing this treatment, I think the most important thing that you should be looking for is experience. Okay, experience of the surgeon, the team, and go to a place where you're not being kind of pushed into having treatment, right? I think these are red flags. Ultimately, everybody watching these videos, right, I think maybe you're in the process of considering dental implant treatment, or maybe somebody close to you is considering it, and you're doing some kind of research. And that's great. You should do research. You should find out as much as you can about these procedures before kind of going ahead. But when you do go ahead, it's really just finding a team that you trust, and you can see that they've done it 10 million times before. Unlike buying something from Tesco, where you can just return it, it's a low ticket, low thought item. Having dental treatment done is like you're really buying into a relationship with that clinic, with that surgeon. And 99% of the time, it will go perfectly well. Okay, it's just there's certain situations where things don't go perfectly to plan, and you want to have a good relationship with the practice and the clinic to basically help you out in those situations. So I know it's been a bit of a depressing video, this one, I'm sorry about that, but I did see this video and it was emotive, and I wanted to just give my opinion on it as well. So I hope you found this useful. If you did, please like. I would love to hear what your comments are on this as well. Okay, all right guys, until next time, take care.